Welcome to this video on ICU. Here in this video, we will be discussing about infrastructure. Infrastructure you needed to establish an ICU in a proper way, which is according the perspective from medical legal purpose as well, because a lot of cases arises from ICU inside, right?
The structure of the ICU or the planning of the ICU should be done in a very meticulous way so that you can minimize the spending and maximize the earnings. And as well as the patient management is also very smooth line and there is no hassle in the day-to-day working of.
करेक्ट सो सर बहुत बार ऐसा होता है कि कई सारे फैटिलिटीज जो होते हैं आईसीयू के अंदर होते हैं और वहां से मेडिकल इश्यूज भी अराइज होता है. तो इट इज वेरी इंपॉर्टेंट यू स्ट्रक्चर एंड द होल द प्लानिंग ऑफ द आईसीयू इज डन इन अ वे, even including the location, the surveillance system, and other things to be taken care, so that the things are planned in such a way to protect yourself.
Yeah. So let us see what we are going to discuss.
Yes. So in this section, we will be going to discuss about 9 critical points for ICU infrastructure. Okay.
These 9 points, if you keep in mind, then your ICU will be the perfect one.
Yes. Okay.
First is levels of ICU. What are the different types of the ICU? Levels, one category. What should be the location of ICU?
Location.
Some people say ground floor, some people say top floor. What is
Correct.
the funda behind it?
Yes.
Then there is ICU design, how to do floor, wall, and ceiling coverings, because it's very important, because once you make it, you cannot do the repeated changing or the, if structural work is remaining or some work is not adequately done, it cannot be done in the running ICU.
And especially the need for वो क्या बोलते हैं सर जम्स का
infection control.
So
infection control is very critical.
Yeah, so the need of infection control is so critical. That's why the floor, wall, ceiling covering has to be very properly done.
In a functional ICU, actually, these all repair work is also not possible. So once it should be done and fitted properly.
Yes. So
and the electrical services, this is very important, because this is commonly the source of fire is electrical mismanagement or electrical overloading.
Yes. And 24/7 you need electrical services, and all the pipeline, gas pipeline, wires, everything, or such a mashed things are going on. So you need to be very careful, because a lot of fire in hospitals start from ICU.
Then HVAC or heat ventilation and air conditioning system, it has a specific guidelines and you have to follow that.
Yes.
And then you have to control the noise level in ICU. Normally, ICU is normally we thought the thing that ice, and it is also very possible, because there are a lot of critical work is happening. So we should be trying to minimize it so that the other patient can be sleeping silently and peacefully.
Correct. And lastly, we will discuss about the equipment.
So it is an action-packed
session is there, and 9 critical points. If you take care of all these 9 points, I think the ICU will be effective, affordable, high quality, and it should be incident free. Okay. So we will go in deep of all this topic one by one. Before this, I just wanted to tell Dr. Pranav Sharma about when it comes about the cost. How much, what should be the kind of budget people should be taking care, and how big an hospital before you venture into an ICU?
See, basically ICU bed per bed you have to range around 4 to 5 lakhs, because it is associated with all the instruments also. Depending upon if you are not putting ventilator on all the beds, it can be a little less also. And especially whenever you are having a minimum 30 to 40 beds of the hospital, then you should have at least 3 to 4 beds of ICU.
5-bedded ICU is what level 1 ICU we can say.
Should have.
We should have, like, if you are above 30 bed, I have 5-bedded ICU is yes, sufficient enough.
Yeah.
Okay. So let's go deep into the mind map, and let's see one by one we will cover each and every topic. If you have any questions, please answer below the video, and please take notes wherever you are watching, so that you have this thing handy when you start learning the things. Okay. So let's go into the mind map. Yeah. So let's go to the mind map and understand the whole thing in a very structured format.
So what are the levels of ICU? So levels of ICU is, first is your ward in which you give the ICU care. For example, if it requires an IV set or oxygen by face mask or some basic management. That is called level 1. Level 2 is HTU, in which most of the facility of ICU are there, but ventilator and dialysis facility are only given a few beds.
Okay.
And level 3 ICU is the fully high intensive care,
Intensive care.
in which you give all the facilities and all the beds.
Okay, so as you increase your level, the sophistication of
It also
ICU
increases.
increases. Okay. So let's talk about the location of ICU. In your plan, in your hospital, where you should actually locate ICU?
See, it is preferable to have it on first floor. Ground
Okay.
floor should be avoided because there is a lot of trespassing in the ground floor. And
A lot of
traffic is also there.
commotion is also
Yeah.
there.
Preferably on the first floor if it is not a small hospital.
Mm-hmm.
But most of the hospitals in which the big hospitals are there,
Mm.
they keep it on the top floor or minus top say ek pehle wala floor.
Mm-hmm.
Because there the minimum traffic is there,
Yeah,
and there is minimum infection rate also.
correct.
Most probably what is there, that top floor is for the operation theatre,
Mm.
and the floor below or the same floor of operation theatre is used for the ICU.
Okay, okay. And the logic is basically to reduce the infection
And trespasses.
Okay.
So basically higher floors are suitable if the elevators are available to
Mm.
ICU in the ICU.
Okay.
Then corridors, lift and ramps are also should be very, very properly planned and spacious, so that at least crisscrossing of the two beds can be done.
Easily done. To the two trolleys or beds are going. Okay.
So 3 to 4 feet is the one bed breadth. So at least 6 to 7 feet and plus minus 1 or 2 feet should be given.
Okay. Okay.
So it should be proximal to the diagnostic facility, blood bank and pharmacy, and there should be single entry or exit point of the ICU. And it should be always manned because unnecessary people should not get entry in the ICU.
Correct.
Thoroughfare cannot be provided in any ICU, and it is always required that you should have a emergency exit.
Okay. So coming to the ICU design. Okay. So
whenever you design the ICU, it is like 4 types of design are there.
Okay.
One is dormitory, like in which the whole ICU is like common beds are there. Okay. Second is single accommodation rooms. Third is isolation, and fourth is the partition.
Okay.
So first of them is the dormitory like ICU. Most of the ICUs are dormitory like, in which many beds are there and they are separated by one another by just a curtain.
Okay.
So these are this is the type of typical
basic
dormitory like ICU.
Dormitory type.
In which there is a light, you can see the light appreciate, and then there are all the bedded panel is given, and ICU bed is there, and this is kind of a triage zone. In triage also this type of facility is there in the emergency care ICU.
Okay.
So around 150 to 200 square feet in the patient care area, and around 100 to 150 is desired between patient relative area and doctor's area.
Okay. So this is the basic like dormitory like cheaper format of ICU.
Most commonly, and not actually the highly intensive ICUs are dormitory like.
Okay.
Because many procedures are happening, critical patients are flowing in, patients are continuously coming in and out, and the really sick patients should be managed in dormitory like ICU only. Okay. Because one-to-one care is usually not possible. One sister is seeing 2 patients, so they can manage in the dormitory like ICU.
So that means it's not about the cost factor. It is more about criticality. The single
accommodation ICU are like relatively patients are relatively stable, or you have the facility of 1:1 nursing, especially in the private rooms.
Okay.
So there where the patient is relatively stable, you can give them the patient care area in about 200-250 square feet and a separated isolated zone in which they can sit or lie down, and their relative can also sit. Something like that. Our facilities are there like a full-fledged ICU.
Okay.
But it has a little more flexibility in the sense that patient relative can sit
there. You can have TV and music. Okay.
So it's kind of a special room ICU.
Okay.
Okay. Then recommended to have 1 or 2 isolation rooms at least when immunocompromised or infected patients can be treated. Okay. So a patient who is having an infectious disease or is prone to infections by outside sources, they should be taken in the ICU.
Especially in the corona and COVID area. Right.
Then coming on to the isolation room proper. These are the area in which the protective environment is there, and the patient are having high risk of infections.
Okay.
Like neutropenia patients or post-transplant patients. These are given positive pressure isolation.
Okay.
And the patients who are highly infective, they are given negative isolation.
Okay.
So they have a greater supply of air, and their fresh air circulation should be almost 80 to 100%. Pressure difference should be 2.5 to 8 kilopascals, preferably 8 kilopascals, and positive flow should be there from the corridor. So
from the corridor,
it should be positive pressure.
Okay. Right. Something like this in this room.
So this is the typical isolation room in which the positive pressure is there.
Okay. Nice. So let's come to the other form, the partition between the two rooms, cubicle and
Partition
beds.
between the cubicles or bed can be most commonly and most cost-effective way is the curtains only. These are the
Curtains.
specifically designed curtains which are washable,
Mm.
and the entry on they are not transparent.
Okay.
And there can be other facility also. You can have partition, you can have sliding doors, you can have partition by either proper brick wall, or there can be now a lot of material is available which can make the
Fabric, the fiber
Fiber
glass.
partitions,
Yeah. And the sliding glass also is
It
much
looks
preferred.
very nice, but it is pretty expensive.
Yeah, pretty expensive. Correct. Okay, so this is like mostly your design aspect is covered here. Let's talk about the zones of ICU.
There
The
are
first
normally
zone,
4 zones. First zone is the patient care
patient
zone,
care.
in which we can have the headed panel. The bedded panel, which we normally see and recommend, is a head and wall panel.
Okay.
This is cost effective and easy to maintain.
Mm-hmm.
And normally in most of the ICUs, this is the one which is practiced.
Okay.
You have the medical gases in it, and
So this
the
is this
light and all
comes
those things are there.
at the back head of the
Head of the
patient.
patient.
Okay.
And then comes another system is called pendant system.
Mm-hmm.
In normally foreign countries, this is the practice adopted, but it is a little more expensive.
Mm-hmm. And I guess maintenance is also required.
Maintenance is also very high, and mostly if you go for international makes, then they are almost costing 3 to 4 times the headed panel which is there.
So that
and it is not actually required.
And in Indian condition, this headed tab is recommended. Yeah.
Only in the isolation rooms or the OT, where we have a lot of work which is there in the head end, like anesthetic movement, intubation of the patient, there it is recommended.
Okay.
But otherwise, the head end panel will work very well with normal cases.
Okay. There's a problem like
there is that if the head end movement is restricted, then we can give a put to the 2 feet wide or 6 inches high
the plank,
aluminum or wooden plank, which can give you some space at the head end, and so that the bed is directly not touching the wall.
Okay, so this kind of the plank is there, and bed यहाँ पे आएगा, and then there is
it will not stick to the wall, and work can be done by any technical personnel or housekeeping personnel in the head end.
By mistake also you can't
you cannot hit the wall.
Okay. Nice. This is a good system.
And monitoring is to be done. Monitors should be placed at the eye level. Should not be too high also and too low also.
Okay.
Too low will be disturbing the patient, and also repeatedly it will be touched by the staff. Too high, I mean the nurses are not that tall.
Yeah.
It will again create a problem.
Correct. Okay, so zone 2 is observation area.
Observation area is like it is a central nursing station in which the main nurse or the senior nurse sits, and the analysis of patients can be done by the doctor. It is the nerve center of the ICU because this is the zone where a maximum work and discussion is happening. It is the place where all the resident doctors are also sitting once they complete the round, and all the monitors must be observable from there. So you cannot walk or you cannot be on your toes all the time. So senior people or the nursing or even the doctors are sitting at the central nursing station.
So it's kind of control system.
It is the central control room of the ICU.
Central control room of the ICU. Yeah.
And most of the ICU are having a central station. It is absolutely very important because at that area you can also see and replay the previous what events had happened in the previous time, hours. And you can have a L-shaped or U-shaped bed arrangement so that all the beds are visible
from this, either in the U shape or you are sitting in this L shape. Okay.
Coming on to the third zone, which is the support zone, which is very important. Usually we don't give a lot of importance to the support zone, and we mess up in the ICU. So if you give good amount of space for the nursing room and stores and toilets and control room, then this will always save you some really good space in the ICU for moving around. And if it is possible, then you should give some good place for the support zone also.
Very important. So now coming to floor, the wall, ceiling, covering, what kind of material we should use. So let's understand the floor.
So floor should be non-slippery. Typically vitrified tiles are there. They're the best option and cost effective.
Vitrified tiles are the best.
Vitrified tiles are there because it is easy to clean and they are good, easy to maintain also. Vinyl flooring is done by some of the places, like it is continuous with the OT, but it is more of cost consuming, and it requires replacement in repeated ways because once the scratch is there, then it becomes a zone.
Yeah, it looks good, but then it will have some
maintenance is high.
Maintenance is high, and also the initial cost is also quite high.
More than that, maintenance is high. You have to repeat every 2-3 years. It becomes scratched.
no lines and wire will be cut over the floor.
Yeah, that is the main thing, because that is why we keep more of a pendant, and head end so should be cleared. Ceiling should be waterproof. There
Right.
should not be any leakages. Good color, soft color should be used. No lines and wire on the running on the ceiling.
Over the ceiling also is very difficult.
Yeah.
So whatever you planning, you should be under the floor.
It should be ideally on the side walls.
Okay.
It is the best.
Okay.
Second option is under the floors.
Okay.
Third is on the head.
Okay.
Because side walls, why I'm telling, because whenever you want to do any kind of maintenance, then if it is on the head end or the lower end, then the ward has to be cleared or it should be emptied. If it is on the walls, then you can do the
Maintenance
by stopping only one of the zones.
So walls, coming to walls like height up to 4 to 5 feet, finish with a similar tiles as a floor.
It is better to clean. It is easy to clean, and wooding panels should always be avoided, because if wood becomes wet, wood is not waterproof, then it is a source of infection.
Okay.
Water will go into it, and then the microbacteria
growth will happen. Yeah.
And wires or lines should be running on the walls.
Yeah, as talk. Correct. So walls, the wires, all kind of, like there are a lot of other than electrical wires, there are pipe gases, pipes,
So
lines.
I'll tell you, whatever, see, there is oxygen pipeline, there is other gases, then there are lines which are taking
water drainage,
then even the dialysis for RO water, even the monitors and those electrical wires. And there are almost 8 to 10 electrical circuit lines.
Yeah.
So these all, if you will plan on the walls, and if you are not correctly planning it, will be a lot of restriction of the space also.
Yes. So first it should be planned within the walls. If walls are not able to sustain because of some architectural point of view, then the floor underground under the floor. Okay, but not the ceiling. Avoid ceiling. Let's come to
the electrical services. Then the main electrical circuit breaker should branch out to individual feeder lines for each ICU. So you should get you should get the line from the main circuit point, because minimum divergence and minimum commonality of the circuit should be there. They should
Correct.
Be separate line.
हाँ. जहाँ पे वो मतलब
So
ऐसा
that it
कुछ
is
confusion ही ना हो.
No, easy to address in case of there is any fault.
Yeah.
And directly from the circuit you can correct it.
Correct.
Second is the electrical generator. You should quickly take over. There should be no transient in between. You should not stop. Each patient cubicle should have at least 7 to 10 duplex ground receptacles of 5 and 15 ampere as per as guidelines. And almost 50% should be given to UPS. So these should be again color coded.
Okay.
That which are on the UPS and which are not on the UPS.
And especially the critical ones should be on UPS, right?
It is preferable to have all the UPS, all should be on UPS. But if you are not having all the UPS lines connection, at least they should be color coded.
So these are the points when things happen in a wrong way.
Afterwards, you cannot change it. We have seen all these problems happening in our ICU.
Correct.
That a ventilator was connected to a non-UPS line, and in the night the ventilator stopped. You cannot do anything in the morning.
And one mistake can cause someone's life.
So it was good that we have found that patient was not requiring that much oxygen. So he survived, but a critical patient can die.
Correct. So very important to understand that these things are so critical to someone's life. So you should take care from the planning stage. Okay.
Even the lighting should be separate from the power distribution board. And in routine, for example, how much light you require. So for a routine physical examination, at least 350 lux is required. And routine procedure of the patient, at least 1000 lux is required. While in the night time, there should be only 5 lux of light.
Okay. Nice.
So
coming to the very important point, many doctors ask us about the HVAC system, and so let's talk about this thing.
See, HVAC system, why it is important? Because this is the only air which patient is going to consume. Or this air will only go to the patient. He doesn't have an option. He cannot open windows. And he cannot go for air if you are restricting it. So very important to plan it in detail. Air movement has to be from the clean area to dirty area. At least 6 air changes in the critical area, where at least 2 changes should be from the outside fresh air. Dirty utilities, loose and in laboratory should have at least 5 changes per hour. So that they don't become stinky. In negative pressure isolation, the pressure difference should be at least 2.5 kilopascals. And it should again be from the clean to dirty airflow. And HEPA filter should be there.
HEPA filter as like all the guidelines are the HEPA filters for the ICU and the OT, right?
And central air conditioning system should be filtering up 99 efficiency down to 5 microns. Temperature is to be maintained according to the seasons. It can be kept between 16 to 25 degrees, and UPS is a must.
UPS is a must. So please give all the due diligence when you are choosing an HVAC system, because it will be like deciding factor for the quality of your IC.
And you should not go for local companies or local makes, because once it is down, HVAC is down, then the whole ICU needs to be shut down. You want to keep the upkeep of the area.
Yes.
So should not compromise on quality in this ICU.
Yes, please don't save money here.
Yeah.
Save on tiles, save on colors, save on other things, but not here. Okay. Yeah. So then coming to noise levels in ICU, again very important thing.
Again, so it should be up to 45 decibels or maybe 40 decibels in the evening, and 20 decibels at night. So you should prefer that the ICU staff is also not making too much noise, and even the monitors are not making any much noise. And that is why it is always like on the top of the floor. If you are having this ICU, then it is always good. Outside voice is not
there. Yeah. And coming to the equipment, so what we have done, there are a lot of lists we have put in the downloadable resources. You can see those reports, different annexures we have given, just to show you list of equipments. These are the list of equipment annexure 1, which is as per NIA USA, and all the equipments are mentioned here. You can go through it. Okay, and then there are other. These are the some bedside standards. Okay, according to levels, some or different kind of at levels, different kind of outlets. Okay, these are the some of the downloadables you will get. Yeah. So this is another annexure, which is list of desirable equipment. Okay, which may not be mandatory. It is good to have, but not must have.
You can, according to your specialty, if it is required, then you can have.
Okay, so all these three downloads you can download from the below this video, and you can add or delete whatever as per your
this
need.
Information is absolutely enough for whatever ICU you are making.
Yeah.
You need to go anywhere else.
Yes. So all this information is from the reliable, very the most official standards which are mentioned in the guidelines. Okay, so you don't have to go and recheck all this system. Maybe some things get updated. We will also tell you whenever there is a updation happens. So please be regular in our inner circle call, and we will let you know if there is some changes. But if you go through this set of videos, you will understand the ICU full and all. Right. Start. So hope you have liked the video and the session and the knowledge shared in this video a lot. And if you like, just press like button, press to subscribe, plus also press on the bell icon so that you can have notification whenever new video like this comes and launch in this channel.
Share it with your friends and other colleagues so that they can also get the advantage of the knowledge. And especially somebody who is opening a new ICU, you must share it with him.
Absolutely.
Must like the video. Because
once this idea of from this video can save lakhs and lakhs of rupees, and also can save a lot of lives also. So please share.
ICU will be hassle free.
Yes. So please share with your friends, or even if you are yourself having this problem now, it can be sorted. If still some problem is left and you want to ask, you can ask question below this video. We will answer it personally, and also if you really want to learn about all this stuff and much more in deeper level about the healthcare entrepreneurship, there will be a masterclass in the coming days. The link which will be given in the below this video, so you can click and register for that masterclass, and please come to this workshop where we will discussing about healthcare entrepreneurship and many other things which normally is not discussed anywhere else, so that you learn the stuff in a particular way and you implement as soon as possible and make it your dream a realization.
So let us see you in the workshop, and you'll get a lot of things out of it. You must have liked the video. If you like, then you share it and give us a lot of likes.
Okay, so thank you so much for watching, and here on this video there will be another video of ICU. If you want to continue your learning, you can continue, and there will be other stuff which we have already shared in this channel. So please go and watch other topics, and we will see you in the next video. Okay, bye bye, take care.
Thank you.